Hello everyone, welcome to another educative episode on Let It Out with Tonia. So we want to look at hypertension in pregnancy. What are the causes?
Now, hypertension is said to occur in pregnancy when the blood pressure of the woman is persistently above 140/90. So we don't usually diagnose hypertension in pregnancy until the second half of pregnancy.
Okay.
Which means
what is the second half of pregnancy?
From the 20th week.
Okay.
Okay. 20th week, that's when the diagnosis of hypertension in pregnancy is made.
Okay.
Now, when we talk about hypertension in pregnancy, we usually group them into 4 groups. Now, the first one is pregnancy-induced hypertension.
Okay.
Now, in pregnancy-induced hypertension, what happens is that the woman just have an increased blood pressure after the 20th week. Now, if the blood pressure occurs before the 20th week, it's a different entity altogether. That one is called chronic hypertension. That means the patient had the hypertension before she got pregnant, and it was not caused by the pregnancy.
Okay.
What that means is that if she delivers, you don't expect that the pregnancy, the hypertension will disappear because she has it already. So the hypertension will continue. So we made the diagnosis of pregnancy-induced hypertension after the 20th week if the woman has a persistently high blood pressure, 140/90, anything above that. Okay. Now, in pregnancy-induced hypertension, what the patient has is just the blood pressure. Now, the risk factor usually is found more in young women. Women who are having their first pregnancy. We call them primigravida.
Okay, primigravida.
Yes, and women who are very young, like teenagers. Okay. It's also found in elderly women, women above 35 years. And most times, such women will go through pregnancy without any complication. They deliver most times normally, except there are reasons for us to operate them. And then most times after 6 weeks...
Sorry, doctor. So it's not compulsory that because the person is hypertensive and the person must deliver through operation?
No, it's not. There must be a clear-cut indication for cesarean section. The only reason why we will do cesarean section if there is a reason for the CS. But hypertension is not enough to do a cesarean section.
Wow.
Okay. Is not enough. Now, that is the first entity you call pregnancy-induced hypertension. Sometimes in some women, this first entity will progress and the woman will start having what we call protein in her urine. Once she starts having protein in her urine, it becomes the second entity we call preeclampsia. Now, preeclampsia and eclampsia are grouped together. In preeclampsia, is a more serious condition than pregnancy-induced hypertension. Now, in preeclampsia, a woman who has preeclampsia has protein in her urine. And because of the protein in her urine and because of the hypertension, the baby and the mother are both prone to a lot of complications. For instance, in the woman can develop eclampsia. Eclampsia is a condition in which the woman starts convulsing in pregnancy that is not due to any other condition but the pregnancy. So, and apart from eclampsia, such a woman, if the BP is not well controlled, can lead to organ damage. Now, the same thing with pregnancy-induced hypertension. It will not get better until the woman is delivered. So, because of that, what we usually do is that if the woman has a severe form of preeclampsia, it might involve admission into the hospital, where our systems will be monitored because, as I said, because of the hypertension, it can lead to damage of our kidneys, our liver, a lot, even our coagulation system, all could be deranged. So what we do is to monitor and make sure that those organs are not damaged while we are trying as much as possible to push the pregnancy to a time when the baby will be able to survive. So in such situations, if we are able to push the woman above 34 weeks, we usually induce them. But if there are indications for us to do cesarean section, we do that also. Now, apart from preeclampsia, preeclampsia, if it's not well managed, can lead to eclampsia, in which situation the woman will start convulsing. Now, and when the woman starts convulsing, it becomes an obstetric emergency, because even if there are no attention, the woman could die from suffocation. So
yes.
at that period, they are unconscious. So we, as much as possible, try to prevent eclampsia when we have a patient with pre-eclampsia by admitting, by giving drugs. So these conditions are usually manageable. Now, the third entity is the one I've described before, chronic hypertension, in which the woman has hypertension before she conceives. While the fourth one is a condition in which the woman is having pre-eclampsia when she already has a chronic hypertension. So we call it chronic hypertension with superimposed pre-eclampsia. So those are the four groups of